Hi, I'm Marty Cohn, and welcome to Episode 8 of Grace Cottage Hospital's Healthcare Matters, a monthly show that discusses healthcare issues on a monthly basis. Grace Cottage is an independent healthcare facility located in Townsend, Vermont, just 17 miles from Brattleboro. Among its services are primary care, rehabilitation, and 24/7 emergency services. Its mission is to promote wellness, relieve suffering, and restore health. In today's episode, we will be discussing men's health with Bill Monahan, a registered nurse and the Community Outreach Coordinator at Grace Cottage Hospital. Welcome, Bill. Actually, welcome back, Bill.
Thank you. Thank you for having me back.
This is your second show on this series.
It is, and it's an honor to be here with you.
All righty. Well, you know, I've been really looking forward to talking about men's health with you because I read somewhere that men take better care of their cars or favorite gadgets than their bodies. I read that somewhere. So,
right.
So just so, you know, here you are, the expert, the registered nurse, just so everyone knows, what's been your path to men's health awareness?
My personal path?
Your personal path.
Well, that's a good question. Being an RN and a male, it's been a long journey. And I started, I'm 58 years old now, and I think when I was in my mid-40s, I had been an RN maybe at that point for 20 years experience, but much heavier than I am now, a little bit more stressed, and not realizing that I was ill, but not suffering the fate that some people do when you get into the longer term illnesses. So I started just contemplating how to better take care of myself, and it's just been a long journey of being more active, definitely trimming my weight down by the lack of diet, not really dieting, behavior changes most of all. There's no such thing as a diet as far as I could tell, and practicing what I needed to preach to do the job I've been asked to do today in community outreach and kind of exploring better health for those in my community. I had to practice it myself.
That is great. So you're not just walking the walk or talking the talk, you're walking the walk.
Right.
That's fantastic.
I am a little bit known for talking, so I knew I had to start to do the walk.
Well, so so I read that men feel like Superman until they reach their late 30s. That's when they start hearing about aching knees and bad backs. So let's run down some health concerns, all right? And not in any, maybe it is in some order, but first one, prostate cancer, colon cancer. I know I just had just went through the exam, colonoscopy. What's up with that? Why should men be concerned about that? When men be concerned about that?
Oh, that's a good question. I had the fortunate experience of working at Brattleboro Memorial Hospital for many years with the gastroenterologist there. And when I first started back in the mid-90s, you started screening patients a little bit older. I think it was 65 or 70 years old, and we would pick up a lot more advanced cancers at that point. And somewhere maybe circa 2000, 2005, they knocked it back to 50. And then at that point, we started picking up more precancerous things. So it showed the importance, in my own experience, in that early screening really pays off in colonoscopy and colon cancer screening. And it's a day's commitment, a little bit of preparation, but it is an actual cure for colon cancer.
I got to tell you that the preparation, I've been having these for a few years, and the preparation has really gotten, I think, a lot easier. But once it's done, I mean, once you're under that anesthesia, you wake up, you have no memory of it whatsoever. Right. So it's something that folks should really do.
Yes.
And you're saying around 50?
Yep, 50 is usually, unless you had a first degree relative that had an earlier colon cancer, and that's an interesting statistic that's starting to show up more and more, that colon cancers are starting to appear more at younger ages, but so they're tracking that a little bit.
All right, let's go to number 2. Number 2, high blood pressure and high cholesterol. I have, again, speaking for myself, Lipitor is my friend. I've been on Lipitor for a while to manage high cholesterol. What should we know about that?
Well, the management of medication management is a good personal conversation between a man and his primary care physician, and also managing their blood pressure. I enjoy my position as someone who is an extension of primary care. And so the demands on primary care these days are great. And so when a physician gets a new patient or patient experience a hypertensive crisis and wants to track that a little bit tighter, they usually reach out to me, and I'll do some home BP monitoring, I'll do some educational things, also make sure they're tracking their medications. But it goes back to showing up. And men have an 80%, I read a CDC study that men are 80% less likely to go to the doctors than women, 80%.
Unbelievable.
And, and I thought that was a phenomenal statistic. So it's getting there, getting screening, and getting the proper education, knowledge, and treatment for a silent killer. And that's what it's called, because men usually don't show up unless they're sick and can't go to work. And that's the main excuse for not going to the doctor, is one of them is going to work, or they have an emergency situation, or they have to go to an emergency room. Otherwise, they tend to fall into that 80 percentile.
So the issue there is when there's a problem, then they're going to the doctor.
Yes.
They're not doing something in
Right.
advance on high blood pressure or
Right.
high cholesterol.
Correct. Correct.
Okay. Well, hopefully we have to do something about that. Maybe this show will help.
Mm-hmm.
Number 3. Now there's been a lot of television commercials on this one. Erectile dysfunction and testosterone levels.
Mm-hmm.
Viagra. What is this something that guys should be aware of? What should they do?
Yeah, I think ED is, I think in 2017, there was about 3 million more diagnoses of ED. And the important thing to ED is that it could be an early sign of many other underlying complications.
Really?
Yeah, so blood pressure issues. On the metabolic side, so we're talking blood pressure, maybe could have diabetes, arterial sclerosis, hardening of the arteries, and usually it could be a vascular issue. And obviously obesity plays into that, heavy alcohol use and smoking, and the list is extensive. Wow. So even as ED presents itself as a component of what it is, it has a lot of underlying suspicions. So the primary care can track down a lot of things, and it seems like men tend to want to use that part of their life still, and so it's one of the hooks that kind of gets them into the system.
But but it's not just a matter of going to get the magic pill, because as you're saying, it
Right.
could be a sign of something else going on.
Right, and I think the primary care it's a perfect opportunity for them to kind of get the signs and symptoms, and then get the patient with other comorbidities going on, and get them into the system and get them better health care. Wow. So it's a way to get into the system. Testosterone itself, and associated with ED, has not been really panned out. That is a totally separate diagnosis and treatment for low testosterone. It's not really associated with ED. It can be, but usually the issues that I talked about in the metabolic side, there's also another algorithm in ED. There's a psychological algorithm associated with that diagnosis also.
Wow.
With anxiety and stress and other issues.
All right.
Yeah.
All right, next one. You kind of alluded to this one. Weight levels,
Right.
as you get older, we're getting wider. I don't know. It doesn't seem to me to be a good thing. What?
Right, and that's the culture we live in. The Western diet is under a lot of scrutiny right now, and there's a lot of information on nutrition and how we in the Western diet approach that. And how we, our sugar intake being somewhere, I think what I read the other day, somewhere for the average American, 149 pounds of sugar a year, which is way over the recommended amount. And so that way we process food nowadays, and higher processed foods create a lot of weight gain. And from there, now the diagnosis of metabolic syndrome, which is association of high blood pressure, high cholesterol, and obesity, which are signs of, again, a lot of underlying, can be cause of a lot of underlying medical causes.
But let me ask you this: if there's a shift in your weight,
Right.
in a man's weight, whether it's going up or going down, is that why they should go to the doctor?
Yes, you should always. If there's a shift up, that to me just is could be a sign of some liver problems, shifting fluids into your abdomen, or there's a couple other problems that can be associated with a rapid weight gain. Also, a rapid weight loss can be indicative of other things to be looked at. A lot of times, tracing, potential cancers and things of that nature.
Now, does alcohol have anything to do with weight shifts?
I think alcohol has to do with just about everything, unless a word you used earlier, which I respect, is moderation. And one of the things that is in every bit of literature and every diagnosis is alcohol, and reducing its use and using in moderation. It can cause a lot of problems when abused.
So the next one, there's been a lot of, you hear a lot about this, diabetes.
Right.
Diabetes. What should I be looking out for as a man in terms of diabetes?
Well, that's a huge topic. As you know, on the community health team, we do have a diabetic educator, Deb Brown, who's been on your show. She does a wonderful job, and she's getting busier and busier because, and once again, weight tends to lead people to be sedentary, lack of exercise, poor diet, increased blood sugars. Now, in my kind of focus, I like to talk about prediabetes. And prediabetes is where you, in the actual diagnosis phase, I think it's the A1C of 5.7 to 6, and blood sugars that you're still making insulin, but you have a situation called insulin resistance. And when a man, typically is in that zone of still making insulin, but yet becoming resistant, overweight, they show up at the doctors, they show a fasting blood sugar that's abnormal. They get put on a medication and it drops it. So it puts a lot of stress on the pancreas, and weight reduction, a balanced diet, reducing alcohol intake, and quitting smoking is the best thing anybody can do for themselves, and lifestyle behavior modifications are important in that.
Well, I'm sure you're gonna be saying a lot of that
yes.
as we
it's
talk
a common
about these
theme
things.
in healthcare today.
Absolutely. Another issue, again, in men's health, strokes.
Strokes overall tend to be on the decrease.
Well, that's good.
But overall, there's two types of strokes. There's ischemic stroke, which is related to arteriosclerosis, obesity, lack of good nutrition, sedentary lifestyle, and the arteries along in the brain become thickened with plaques. And then when an area of the brain becomes so restricted, it can cause a stroke.
Wow.
Yeah, which has, usually one paralysis, single side, unable to talk, and leading to further problems unless it's treated.
Now, just before we get too much further, so we just rattled off 6 issues.
Right.
Are these issues, are you seeing them just in men, predominantly in men? Or are you also seeing them in women? I mean, is there the topic of the show is men's health, but
Right.
are these just men's health issues?
No, they're not. But one thing that leads to men's health issues is what the research is showing is when a young man leaves his pediatrician at 18 years old, women tend to be pushed towards yearly gynecological exams, checkups, and stay in the system throughout their lifespan. And things are caught early. Prevention is a part of a lifestyle based on that process. When men move away from their pediatrician, it looks like they tend to be lost to the wind until they end up at late 30s and early 40s and get injured or start having a bad back and the weight gain and the self-abuses that happens during those years.
So this is again a situation where it's being proactive in terms of seeing your primary provider,
Correct.
primary healthcare provider, could help in dealing with a lot of these issues in
Right.
men's health.
Right.
So in preparing for the show, I went to the Center for Disease Control and Prevention,
Mm-hmm.
and the list of the greatest threats to men's health was surprisingly short. But I got the top causes of death among adult men in the U.S. are heart disease, cancer, unintentional injuries, chronic lower respiratory disease, and stroke. So what lifestyle, you already talked a little bit about this, but what lifestyle changes can lower the risk of these common killers?
I think, if we let's talk, the top three would be, I think getting high amounts of sugar out of your diet is number one. Number two, alcohol reduction. Number three, quitting smoking. And then number four would be increasing activity and a less sedentary lifestyle. And so, though in a balanced diet, what I've kind of been interested in nutrition and how it affects lifestyle, because I personally went through a transformation in the past 2 years. So I've had the opportunity to kind of live what I'm kind of trying to practice as an RN and teach. So those were four big. I didn't smoke cigarettes, and I was a moderate alcohol intake, but it was the sugar that if you told me like 2 years ago I wasn't going to eat that donut anymore, I would have told you were nuts. And then once you kind of get those things out of your life, or use them as a treat once a week, or rather than every day, your life can change.
I believe that. As I told you earlier, for years and years and years, I started my day with a cup of coffee and 2 donuts. Not 1 donut, 2 donuts. And finally my wife said, cut out the donuts, and I said, how could that be? So I went down to 1 donut. Now I can't remember the last time that I had a donut.
No, me either.
And I feel better for it. I truly do.
Right.
So I think that those are everything's possible in moderation. If you told me quit donuts cold turkey, I might have had a problem there.
Right.
But I think as I became more aware, and I really have to credit my wife in keeping me on the straight and narrow in terms of eating healthier food. Now I would also suggest that living in Vermont and the food, the fact going to farmers market and eating the fresher vegetables has to have a positive impact.
It does for me, because I get to drive by a vegetable stand every day, and they have a greenhouse, so I'm actually getting fresh greens at least twice a week now, and I cherish that, because you don't have that everywhere, and those are important in a very balanced and colorful diet. You want color, you want as fresh as you can get, if you can get it. Frozen is just as good, organic, fresh frozen. You want to also, or especially when you move into the proteins and higher in the food chain, so you want antibiotic, hormone-free chicken, you want wild-caught fish, you want grass-finished beef, and organic dairy, and those things in moderation also are tolerable and well managed in a good behavior modified diet.
So what you're saying though is you have to be aware of what you're putting in your mouth and actually looking at the ingredients.
So it's one of the biggest risk factors. What's on the end of the fork, really will have a payoff for you either way. And it's a tough lesson to learn, but for me, I don't know about your experience, but I remember when I started myself, I removed sugar from my coffee, and it was just a progression. And then all of a sudden, I didn't crave sugar anymore. And then I can go, now it's from that to intermittent fasting and enjoying some ice cream maybe once or twice a week still. It's one of my faves.
Right. We don't want to be, go overboard on something like this. So, so here you are at Grace Cottage Hospital, and you run a men's group, right?
Right.
How does that work?
Well, as outreach, I had the opportunity to kind of reach out to the community and got involved in a few projects. The men's group spun out of a need for some gentlemen in the community that isolation, especially in the West River Valley here in Vermont, and in the winter. So last year, to get the hook in, so to speak, I had the dark days of winter. It was 12 weeks from after the holidays through maybe I go to beginning of April. And so as the days are short and it's colder, I had the West River Railroad come and talk, and we had 16 or 18 men show up at that, and a variety. The forester, Bill Gunther, came, spoke to my gentleman, and so we had just lectures to get men out, and those were very popular. And so this year I threw the twist in. So we turned it from get them out, come and socialize, have a cup of coffee, one of Jim's great baked banana bread, piece of banana bread or a muffin, and just share a story. And then this year I was kind of skeptical because I kind of put an educational health twist on it, but it seems my numbers in the group is going up from week to week. We did some diet things. Tomorrow we're doing some prostate education, on PSAs and just treatment options and education, things like that. And so I have every week, PT lady coming from the physical therapist for fall risk, just dangers around the home, things of that nature to come in and chat. And the men are coming out and they absolutely enjoy it.
So you're doing this on a weekly basis?
I do it every week from January 1st to April 1st, every Wednesday.
Every Wednesday.
Yep. At Grace Cottage, we have a men's group from that one's 9 to 10. I also run a second one. I was asked to do one in Grafton, and we do that one. And it's a smaller. The community has different needs, but it's still that started out health education based, community based, and that's a great group of gentlemen. And I have one man that comes to both, and he enjoys it so much. He comes to all the lectures and shares the stories.
And is there a cost for this?
No.
The
only cost is that you have to kind of put up with me for a few minutes, but other than that, they seem to tolerate that okay.
Wow. So on a week, and if they're interested in participating, they just show up, or do they call first? How does that?
Well, right now on my list, I think there's about 30 or 35. I have my email group, so I usually send out an email every week and just let them know what the agenda is. And sometimes I have to cancel due to weather, like last week. So I have my group pretty well tuned into their emails, and most of the guys.
But what if I want to join your group? Do I?
Well, we advertise on. Jackie Brown puts it on our Facebook page, and it's on our web page, the Grace Cottage web page.
So I could just go there.
You go there and look at the men's group. But now, mostly the group is focused. And once you get into the group, I get an email that puts you in the loop till you don't want to be in it anymore.
By the way, you're serving coffee?
Yes.
Is there sugar for that coffee?
I have sugar, yes, but it's not very well used. I watch, and a lot of men at that age don't use sugar. You know, if anything, they're using the yellow or the blue packages there.
So, and what when you say that age, what are we talking
Well,
about?
my average age, I think, is probably 78 to 80.
Wow.
Yes, and I have some people in their mid-80s and some people as young as maybe 70, 65 or 70.
Okay.
And I think I do have an 88 or close to 90-year-old that comes.
Wow.
Yeah, yeah. So
All right,
it's a lot of fun.
That actually, all right, this is last question.
Sure.
'Cause when should men, you know, you're talking about your group and it's in their 70s and 80s and 90s. When should men be most concerned about their health?
Well, that's a good question. I think when should men be concerned about their health? I think when they stand up in the morning and look at themselves in the mirror from the minute you wake up, and that's the inspiration that I think I feel, and try to, when I assess somebody and educate them or just getting to talk to somebody, is to plant that seed of behavior change, you know, because health is a lifelong daily process, and I think we've taken that for granted and for a long time.
And I think that what you're also saying is it's okay to come in and talk to you or your doctor or your primary care provider, talk to someone. No one's going to think any less of you,
Right.
if you're asking these kind of questions.
No, and I noticed, I've had the job for a couple of years now, and I noticed that trend for people coming in and wanting to talk, and wanting to make those changes and need help to do that. And our doors are open for anybody who wants to stop by.
Fantastic.
Yeah.
Bill, thanks for coming on the show, and thanks for all that you're doing.
Oh,
I
thanks
mean,
for having me.
it's really important. It's really important stuff. I want to give a shout out to Roland Boyden, who does all the magic behind the cameras. I also want to thank BCTV for helping us bring this show to you. If you have any questions, concerns, ideas for future topics, send them to info@gracecottage.org. info@gracecottage.org. I'm Marty Cohn. Thanks for watching.